rheumatology didn't really pop on my radar up until I had been practicing for about 3 to 4 years. When I finished my training in 1999 as an internist, I was in the Air Force and I wanted to serve as an internist. I'm proud. So I guess I should step back. An internist is a doctor who takes care of adults, and I was always very proud to be an internist. I still remain proud of that. I'm a member of the American College of Physicians. As an internist, you get to focus on the entire picture for the patient and try to manage multiple different conditions and being their regular doctor at the same time. And that's challenging, but it's a very noble endeavor, and I really was very blessed to have great interactions with my patients and see them prosper and thrive. But rheumatology came up on my radar in the early 2000s. We started to first see the first wave of the new medicines that were really transforming rheumatoid arthritis from what was a debilitating and very frustratingly difficult disease to treat. In the late 90s, when I was finishing my training as a medical student and resident, we really didn't have much more beyond methotrexate and gold shots. So we didn't really know how to effectively treat rheumatoid arthritis. But in the early 2000s, as medications such as infliximab, adalimumab, etanercept came out, and that was the first wave of medicines that really transformed rheumatoid arthritis from something that was once observable and watching the damage almost as watching a slow motion train crash. They transformed that to a now manageable illness. And as I studied it more, I saw that there might even be the potential for us to identify these patients earlier and potentially either arrest the disease or even cure it. And so that really fueled my interest in rheumatology. At the time, I was actually using those medications as an internist for my patients who had Crohn's disease and ulcerative colitis. And back then, it was off-label for ulcerative colitis to use those medications. But it was the promising therapy for those patients, and I saw a great future. And rheumatology also lets you focus on the entire patient. We pride ourselves as internists as being kind of super internists, I guess, and I should say that very cautiously because that's a very big title and mantle to wear, but we really pride ourselves on trying to get down to the root of the problem and take care of what we can. Not to say that other specialists aren't that way, but for us, we get to focus on the whole patient still.